Emergency and urgent care. There is a difference between those two, but what exactly are the differences? We're going to find out what those differences are today, as well as when it's appropriate to seek one versus the other. My guests will include Sharon Warden, who is the Director of Emergency Services and Progressive Care, and Dr. Kevin Whitney, Medical Director of the Emergency Room here at the Bluff Medical Center. I'm Justin Riley, and this is Wisconsin Doctors. Welcome back to Wisconsin Doctors. We're here at Bluff Medical Center, and we're learning about the differences between urgent and emergency services or emergency care. And I'm joined by a great panel of folks here today. This is Dr. Kevin Whitney, Medical Director of the Emergency Room, and Sharon Warden, Director of Emergency Services and Progressive Care. Thanks for joining us today. I should say thanks for hosting us today, because we're here at Bluff. So let's start off by discussing the differences between emergency care and urgent care. What is emergency care?
Well, one of the first differences between emergency care and urgent care are the hours of operation. So in emergency services, the ER is open 24 hours a day, 7 days a week. The urgent care, on the other hand, is open for 8 hours a day. So it opens up at 4 o'clock and it shuts down around 10:30, quarter to 11 at night.
Okay. From a medical point of view, emergency medicine, we think of those things you might see on TV when you watch a TV show. It's pretty intense. You're thinking heart attacks, you're thinking congestive heart failure, you're thinking some respiratory distress, whether that's asthma or COPD, somebody who's really sick with high fevers, somebody who's confused, you think about strokes. So you think about really intense, emergent, somebody needs to act upon this immediately to make a difference in my family member or myself before something bad comes from it. Urgent care may be something you are less urgent than an emergency room. Maybe I'm just not feeling very well. Maybe I've injured my knee and it feels a little wobbly and I want it to get checked out. Maybe I've got this headache that's a little bit more than I'm used to and I just want to have this assessed. So there is definitely a difference in sort of the intensity and how quickly one would need to be interacted upon to achieve better health.
Yeah, absolutely. And now you guys are considered a level 3 trauma center. What does that mean?
Well, there are actually 4 levels of trauma, and level 3 it means that we have met the state criteria for trauma care in a smaller facility. Level 2 would be someplace as a community hospital, much larger, and level 1 would be like your UW hospital.
Okay.
From a perspective of where we're located, it's very important to be aware of this because we do have a major highway that runs by here, so you're going to expect trauma, and car accidents tend to be one of the leading areas where trauma occurs. We also have a lot of recreational activities, whether it's winter or summer, and you think about things up at the lake where trauma could be involved. So it's important to have a center that has a higher level of trauma that can interact with some of the more major injuries that could occur. Even though we're considered rural, we're located by areas where a lot of trauma occurs. So from a doctor's point of view, you can expect somebody has a major auto accident, we'd have the ability to intubate that patient. We'd have ability to put a special tube in their chest called a chest tube if they're having some problems with blood in that lung space or if they're having air in that space. So we could do some interventions along those lines. We could set and stabilize major long bone injuries such as fractures to the femur. We can manage and stabilize pelvises, but most of that is aggressive, intense stabilization in that critical 30 to 60 minute window, and then preparing that patient for further transfer to like a major trauma center such as UW-Madison or some of our larger facilities in the area.
So there are some things that you guys can take care of here, but then you can also prep patients to be taken to like a level 2 or level 1 trauma center as well.
Right. Yeah. And most of it, I would gear it toward the prepping, like really stabilizing that patient in a manner that they're going to succeed to be able to make it to a major trauma center. Because a lot of times you look at that critical 30 to 60 minute window time frame, and most people know where we're located here. That we're further than that from UW-Madison, which is our major trauma center. So you need somebody to stabilize you so that you you can make that 30 to 60 minute trip. And you're going to see a lot of that's where our focus is. And you look at that as, the trauma survival time frame. It's very critical that we act upon many of these as fast and as quickly as possible.
Absolutely. Before we head to break, are there any tips that you would be helpful for viewers or patients?
I think the one thing that comes to mind is when trying to decide for yourself whether or not you need emergency room care or urgent care, think of what types of things you would call the clinic to see your doctor about versus things that are life-threatening.
Right, right.
And I think one of the things that I find sometimes patients come in and they're really just looking for reassurance,
right.
Whether they're seeking care in the emergency room or urgent care. And sometimes if they come in and find out, oh my gosh, it's just a simple cold, and maybe in their mind, I like for them to know that we like to see that as well. We like to give them the reassurance, and maybe we can't do anything about it for the simple cold, but maybe just give them some advice. But we still like them to come in. Just the sense of peace of mind and reassurance is what we're really about as well. And let us decide help them decide if it's urgent or emergent, so that they just can leave with a peace of mind. And maybe not always a prescription. Sometimes the peace of mind is more powerful than a prescription, or this is the exact way we're going to manage this process.
We got to take a short break. When we come back, we're going to talk about waiting room expectations here at Mile Bluff Medical Center. Don't go away. We're back here at Mile Bluff Medical Center on Wisconsin Doctors talking about the difference between emergency and urgent care. And, I'm curious to know, because we're talking about waiting room expectations in this segment. And I've heard it said that there are two classifications of patients using the same waiting room. What exactly does that mean?
Well, because our urgent care and our emergency room are both centered in the same location, the patients in that waiting room are urgent care and ER patients, and ER patients tend to be a little bit more acute, a little bit sicker than urgent care patients. So the confusion comes in when you think about first come, first served versus people being taken to a room based on their illness and based on what they're here to be seen for and their classification.
Yeah.
I think we find a lot of patients understand that. I find a lot of patients understand that if they're there for something like a common cold, that we may be engaged with a heart attack or something more serious. And that's really what we're looking for. I think all of us would agree if we'd much rather have a family member with a heart attack addressed immediately and taken care of.
Right.
But sometimes we have to let people know that because they can't see the whole environment. They don't always know what the doctor or the nurses are doing. So it is good on our part to remind, and it is also, I think, at least my experience working here, patients seem to be very understanding if we explain to them that it took us a little longer to get to you here because we were engaged with some pretty critical care elsewhere in the emergency room.
Yeah, they have to understand that. And I've heard this word used a lot too, triage. And they say talk to the triage nurse. What does triage mean, and what can someone expect during triage, and how does it affect care?
Well, the triage process is a systemized process that is sort of laid out for emergency rooms and ERs all over the country, and it's pretty constant. So we take a look at the patient's vitals, we take a look at what patients are here for and the general history of the current illness, and then we make a decision based on that of what kind of care that they're going to need and how many resources that care is going to require, and then that will indicate to us where they should be triaged, whether it is an emergency room visit or an urgent care visit.
So it kind of different classifications of
Yes.
maladies or injuries or whatever it might be.
Exactly, and then they're kind of given a classification of numbers 1 through 5.
Okay.
So where number 1 would be the highest acuity patient that would need the most care and the most resources in terms of people as well as supplies and lab versus radiology, and then number 5 would need the least.
Sure, okay.
And from a doctor's point of view, the nurses obviously do a triage when the patients come in, but as a doctor, I'm continually sort of triaging the situation in the emergency room, trying to always think what patient is most critical and needs me now, and if I don't interact upon that, a patient could go from being sick to being really sick.
Right.
And there's various situations where triage is different. Having been an Army doctor, we use triage a lot in a combat situation, trying to figure out who is more likely to survive, and we want to put all our energy in that situation to get them to a place that they're going to survive. In this mode, we use it often just to see how soon you might need to be seen or how immediate your needs are and who we should be addressing first. But everybody gets seen in our emergency room and urgent care. Some may just have to wait longer to get access to a doctor.
So it's not necessarily first come, first serve in the emergency department.
It definitely is not.
Right. So what benefits might someone experience if they decide to come to Mile Bluff's emergency department or emergency room or urgent care as opposed to a more urban hospital?
Well, number one would be convenience. We're certainly more rural and closer to the population that's in this area. But number two is the sense of family and the sense of a small community of care. We have very highly qualified nurses in our emergency room and urgent care. We have nurse practitioners and physician's assistants that are in the urgent care department. But everybody just is a more family-oriented type of environment and a very caring environment.
I think one thing, we're a busy ER. It's definitely for a rural, but there's clearly much busier ERs, especially when you get larger cities where the volumes of patients are just somewhat overwhelming. So triage plays a role much more in their situation. So for example, if you came in with a common cold and your vital signs are relatively normal and stable, you might get triaged to the point you might sit there 6, 7, 8 hours before anybody could see you because there's so many more critical or urgent needing patients ahead of you. Where in our situation, you may have an hour to 2 hour wait for something like that if we got something really critical going on. But most of the times it's a pretty quick turnaround, certainly much quicker than if you found yourself in a very busy, large ER in a city. And I think our patients have come to appreciate the timeliness of those visits.
We got to take a short break. When we come back, we're going to talk about when it's appropriate to seek emergency care and when it's appropriate to seek urgent care. We'll be right back here at Mile Bluff Medical Center. Welcome back. We're here at Mile Bluff Medical Center with Wisconsin doctors, and we're talking about urgent care and emergency care. And right now I want to talk a little bit about the difference, well, not the difference, but in what circumstances you would seek urgent care versus emergency care. Can you talk to us a little bit about that?
Sure. For urgent care, if you were feeling ill and it's something that you would call your clinic doc and try to get an appointment, then that's probably an urgent care type of visit. Things like cough and congestion, cuts requiring stitches, small cuts, bruising, diarrhea, ear infection, the things that kind of just make you feel all over miserable, but don't feel like it's a life-threatening situation.
Okay.
From the emergency room, obviously the ones we really would want people to show up are the ones that we can make a critical difference on their survivability. So you think about strokes. The sooner a patient recognizes that and arrives in the emergency room, the much more likely we are to have some sort of intervention that might help that patient survive, or more than survive with some intact functioning. Same thing you think about a chest pain symptom. There is a short amount of time to act upon those scenarios to make sure the patient has survivability. So strokes and heart attacks are the ones that come to mind the most. But then people with a trauma or injury that, again, we talked a little bit about coming in so that we can intervene with that. Oftentimes they're coming in with EMS service or emergency service providers are bringing them in for those things. We see a lot of abdominal pain. A lot of that is just because patients are uncomfortable. Abdominal pain can be very painful. And we have a lot of tools in our toolbox to try to ease some of that discomfort, especially if it's severe. And there are those cases, it's not terribly common, but those cases that may be more critical and may even need some surgical interventions. So those are the big ones. And then people come in with all sorts of chronic complaints of pain and sometimes severe pain. You think about headaches being something that people would often see in ER for to be evaluated.
Yeah, it sounds like time is the big difference between urgent care and emergency care. If time is not as critical, it's probably an urgent care issue. So, you mentioned, Dr. Whitney, about stroke and chest pain. I'm just kind of curious from both of you, what are some other major warning signs that a patient might experience that would require either emergency care or urgent care?
So from an emergency point of view, the things that really bring patients again to the emergency room is just a lot of their concern. But again, we separate the people who just have some concern and need reassurance to people that are critically in need of an intervention. I think probably this time of year, the ones that's catching us the most is COPD or emphysema or chronic obstructive pulmonary disease. People with underlying respiratory problems who get sort of a simple common cold, that common cold triggers sort of an abnormal response in somebody who's already sick that makes them hard for them to breathe. And we do see a lot of that, and of course we want those people to come sooner, because usually the sooner you intervene, you can prevent that progression to more severe, like respiratory failure, which would require sort of intubating, put a tube into their lungs and hooking them up to a machine to breathe through them. So we do see a lot of emphysema or COPD, or people who are just frankly short of breath, or even asthmatics being triggered by our flu season or upper respiratory colds.
Sure. Did you have anything you wanted to add to that, Sharon?
Well, I would just say that in some of the conditions, such as stroke or a heart attack, there's a window of opportunity that we can intervene and the patient can have a positive outcome. And so that the sooner those patients come to the ER, the better.
What's the number one thing that someone should know when deciding whether or not they should seek care?
Well, number one is that we cannot give medical advice over the telephone. The reason for that is because we can't see you, and we can't touch you, and we can't listen to your lungs or make any kind of assessment. So in order for us to do that, the best thing is for you to come in and see us. It becomes more of a legal issue when you're talking about giving legal advice or medical advice over the telephone.
Yeah. Absolutely.
And I think the other thing to be aware of is we are a 24-hour service, and so we're available to our patients in this community all year round, every hour of the day. And we if they just need reassurance, we're there for them. I would say that some of the things that probably are not well served in the emergency room is people with dental pain. They tend to benefit better from seeing a dentist. Doctors are not trained in dental care to the level of course, a dentist would. And so a lot of times patients may seek care in the emergency room for dental issues that they would be better served if they saw their dentist. And I think the same thing often goes with an eye sort of issue. Showing up in the emergency room for the ER, we can certainly do some basic stabilization things, but you think of the training, the experience, and the equipment our eye providers in this area have. We just don't have those tools or the skills. So I think those are the two big things, is that sometimes seeking care from a more appropriate professional provider in those two areas might be more helpful for some patients.
We got to take a short break. When we come back, we're going to wrap up our show talking about the importance of establishing regular care with your primary care physician. Don't go away. We'll be right back. Welcome back to Wisconsin Doctors. We've been here at Bluff Medical Center discussing urgent and emergency care and the differences between the two. We're going to shift gears just a little bit and talk a little bit about the importance of establishing regular care with a primary care provider. Why is that so important?
Well, it's really important that there's a provider that knows you, that gets the whole picture of who you are, your social life, your medical history, all of the pieces of who you are. And emergency room care, ER care, is meant to be a sort of an intermittent thing when there's an emergency or when there's something that you can't get into your provider for. But also, the big piece of what we do in the ER is then communicate with your primary provider. So they know what's going on, that you've had this illness and this is what we did, so that they can follow up with your care and give you a really rounded quality of care.
Yeah, absolutely. It seems like, it's kind of hearkening back to the days where you had the doctor that made house visits and knew you personally, knew you on a first name basis, and that's kind of what we want to try to establish with our primary care providers.
Correct.
Yeah, I sometimes patients come to the ER so much they start calling us their primary care provider, but we do want to redirect them, because there is no substitute for a doctor who again knows the bigger picture and can provide you that continued continuity of care through this acute illness, then when you're well, and then with some of your chronic issues. And I think that is a very important piece to emergency medicine, is that follow-up care with your primary care provider.
So let's tie in the primary care with prevention of needing emergency or urgent care services by covering one of the most prevalent illnesses at this time of year, influenza and acute gastroenteritis. Did I say that right?
You did, you nailed it. So Influenza, obviously, you pay attention to the news, it's really out there. It's been hammering our area just like it is many areas of the country. And the big thing for people to realize is the most important thing they could do would have been last fall, is to get the vaccine. And I know people hear a lot of different stories across the board, but the truth be told is the influenza vaccine does not cause the flu. It's a dead protein, so it doesn't cause flu or even illness for that matter. So the other thing is people are hearing that it might not be fully effective, but the truth be told is even when it's not fully effective, it does shorten the course and intensity of the flu illness. And we're seeing that in our patients. Those that have gotten the flu, some of them may still get influenza, but they just have a much shorter, less intense, less severe course. Those that opted not to get it tend to be a little sicker, lasting a lot longer, and certainly we've had cases of very sick patients coming to our emergency room with influenza, which is very difficult for them, their family members, and then some of our community losing members of time and service at their work because of the illness. So it's definitely something to be aware of. Flu season may or may not be on a down decline, but just as it declines, we get gastroenteritis. So if you followed the Olympics, we know norovirus hit them pretty hard. We know that norovirus comes our way every year. We expect it any time. We may even be starting to see it. This last shift, I saw a lot of people with gastroenteritis, which really includes upset stomach, nausea, vomiting, and sometimes diarrhea. And often it can be short, 24, 48 hours, or maybe even a week or more. But really, when it comes to both of these illnesses, most healthy people there's not a lot we can do in the emergency room. There's really no treatment for most people that are healthy for either illness. Both illnesses run their course. Both illnesses rely on our immune system for success. Really, the people that should be seeking care for us is people with suppressed immune systems, weak respiratory systems, weak GI systems, the very young, less than 2, the very old, less or older than 65. But most everybody else is going to weather through with symptom control.
Yeah, absolutely. We've just got a few seconds left, but obviously you mentioned that if you come up with if you come down with either of those two ailments, that there's really nothing that can be done in the emergency room. So what can people do at home if they do come down with either of those?
So the most important thing with gastroenteritis is hydrate, and the best solutions out there are Pedialyte, and Gatorade can also work for that. But really ensuring you're getting 6 to 8 ounces every hour, even in the face of vomiting, can help reestablish a good hydration pattern and help you weather through. There's some thought that probiotics may be helpful, and speaking to your pharmacist to get the right dose on that, or your primary care provider would be helpful. And then just taking your time to relax and get plenty of sleep and rest. As far as the influenza, it's mostly comfort care measures, saltwater sprays in the nose, gargling salt water. But a lot of the cough medicines really, they may help with symptoms, but they certainly don't help with the disease, illness, or the process.
Yeah, lots of good things to consider. We're out of time already. We could have probably talked for another 5 minutes at least. Yes. We're out of time. We'll have to come back next month.
Right.
This is Dr. Kevin Whitney and Sharon Warden from the Emergency Services Department. Thank you so much for joining us today. Thank you to all of our viewers from all of us here at Mile Bluff Medical Center and Wisconsin's 57 Television. We invite you to live longer, live better. We'll see you next time.